Case can spiral into many. There are now 89 total infections related to the hockey outbreak in central Vermont, which then led to a domino effect of 4 additional outbreaks and exposures at 19 other locations. As Local 22's Jolie Sherman tells us tonight, this really has a long way to go after just one case, and she is live in the newsroom.
Well, good evening, Lauren. In today's COVID-19 briefing, Commissioner Michael Pieciak pointed out that fortunately there are no fatalities related to the central Vermont outbreak. The majority of those affected are said to be younger individuals or in college. Pieciak also confirmed a link between this outbreak and St. Michael's College. Governor Phil Scott and members of his administration say while Vermont's success is something to be proud of, they highly warn against becoming complacent.
The outbreak in central Vermont has accounted for 26.5 of all of the cases that we've reported over these last 2 weeks.
And Health Commissioner Dr. Mark Levine says, now we're seeing what happens when we let our guard down.
And while we should be proud, we may have gotten a little too comfortable with our relative success, thinking Vermont is different than other places. But Vermont is not safe from COVID-19. Nowhere is.
In fact, as of Thursday, the country exceeded 9 million confirmed cases.
This is notable not just for an additional million cases being added to our total, but that this was the quickest we added 1 million cases since the start of the pandemic.
While Vermont's case count is among the lowest in the nation, the virus is still spreading and doing so quickly. In fact, it only took days for the hockey outbreak to go from 1 case to 13. Now that number is close to 90.
Just one case can quickly spread to multiple communities, multiple schools and work sites and colleges and other settings.
State epidemiologist Dr. Patsy Kelso confirmed a link between the central Vermont outbreak and cases at St. Michael's College, where there are 41 cases, with an additional 6 reported Thursday.
I think the most important takeaway from this is that we all have a role to play in preventing the spread of COVID-19.
Dr. Kelso identified several behaviors involved in Vermont's growing case numbers, including gatherings, failure to wear masks, and not following quarantine rules, if identified as a close contact.
We have the tracing and testing capacity to manage our way through these types of upticks. But we also need the help of all of you to mitigate this.
Governor Scott urges the state to limit gatherings, refrain from traveling, and follow quarantine guidelines if you decide to do so during the holidays. Reporting live in the newsroom, Jolie Sherman, Local 22 News.